In terms of relationships, let's go back to that a little bit. Is there a component of hypersexuality or potentially like the higher risk of cheating or infidelity in partners with ADHD?
So I don't know exactly what the data shows on that because I mean you'd have to get a very honest broker to be to disclose that, right?
Yeah.
So, but what I can tell you is anecdotally from the huge population of patients that I've had and from looking through like my own personal experience dealing with this, I think there is, just like we talked about in the beginning, there is that dopamine seeking behavior. You feel uncomfortable with stability and this smooth sailing. That is very unsettling for a lot of ADHD brains. And so yes, there is this feeling like this, I want to seek out novelty. I want something new. I want something exciting. And so that can be that you're hopping from one partner to another. It can be that within the context of a relationship that you're dealing with cheating. And again, this isn't an excuse. This is an opportunity to discuss behavior because having ADHD is not an excuse to cheat on your significant other.
Yeah.
It is an opportunity to be like, this is why this happened. This is I need to correct this behavior or I need to leave this relationship. So it's looking at it in a way that you are understanding from a neurobiological perspective and a judgment neutral perspective. I think that's what's really should be talked about more with ADHD in the context of relationships. I think that there's a lot of emphasis placed on like, this person is a cheater, they're to blame. And I want people to take accountability and ownership of their behaviors. But I want them to also do that in a way that they're not like piling on a lot of self-loathing with that and being like, this is how my brain works. This is how I aim to work with my brain so these behaviors don't continue to happen. Because I don't think anybody who has cheated on a significant other or been cheated on loves that process, right? That seems very stressful. And so I think that there is definitely an opportunity to understand there is a propensity and a desire to go towards new, novel things because I'm understimulated at this point. How do I correct that without blowing up my whole life?
Yeah, I think that's so important. If you are an adult, because there is obviously adults who have not been diagnosed with ADHD but have it, and either you see your partner or you yourself have characteristics and you're listening to this like, oh my God, this is me.
Yes.
How common is it to get diagnosed as an adult? Is this something that they should seek help for?
So I'm biased. I think yes, because I think honestly anything that helps you understand your own brain better, go for, right? You should, if you have the means to do that, you should understand your brain better. Is it common? I mean, a lot. It's getting more common now that this is becoming more part of this cultural dialogue. I think a lot of that depends on who you see. So, if you are going, sometimes if you're going to a primary care doctor or if you're going to a therapist that isn't well versed in ADHD or really anybody, like even psychiatrists are guilty of this also. For people who haven't been well trained in ADHD and are only picking up, that typical childhood presentation, they're not willing to look for things that are outside of the scope of what they know. So just researching your provider, making sure they're well versed in ADHD and all of its facets, I think is important. And the way you do that is simply by looking them up and seeing that they talk about ADHD, that they cover ADHD, that this is one of their clinical expertise areas.
And then in terms of like, is there something as a clinician, like as say someone is listening and is a clinician that they can maybe read up for themselves or give a patient a quick questionnaire or something that they can do quickly in their office to assess for it?
So I don't love that. And there isn't anything because I think the correct way to diagnose ADHD and to look into that is look at all of it in a comprehensive manner. I want to see what is this psychosocial stuff that's going on. What is the underlying medical stuff that's going on? Is this all a thyroid thing? Is this all like something because of adrenal fatigue? Is this, what is this actually doing? So it's important to get that positive criteria to say, yes, this looks like ADHD, but also to rule out all the stuff that it might not be.
So I think just ruling out the other things potentially and then referring to somebody who is an expert. Okay. In terms of relationships again, what I've been told is that people who have ADHD who have sex tend to struggle, sometimes because they're easily distracted or it's hard for them to focus. And of course, I talk about this a lot, but it's really important to be able to focus on the pleasure, enjoy the pleasure,
yes,
and be present in the moment, which regular people have struggled with, but
yes,
ADHD people will struggle with more. So what do you see in terms of sexuality?
I think it's twofold. I think if you're looking at like the focus component, that's one thing, but also there's a strong emotional component that comes with it. With the focus component, sometimes it's hard to stay engaged with your partner. Like quite literally, you are running through like, does my body look weird? What should I be doing? Should I, like, how long is this going to last? Because I have to go and do this other thing. And then you get distracted within the actual context of having intercourse. There is also a strong emotional component that comes with that, where you're dealing with, like, you're consistently looking at your partner's body cues, face cues, talking cues, and you're like, is this different? Does my partner still like me? Does it, and so there's a lot of rejection, sensitivity, and inward stuff that I've heard from a lot of patients that makes having sex just, instead of being a pleasurable experience, it becomes this opportunity for them to hyperfixate on anything that could be wrong and imperceptible to everybody else within their relationship.
So how do they get through that?
Again, communication, I think, is so important. And I think talking to your partner about, like, I'm having a hard time staying connected. Or I had a patient who was telling me, she had a really difficult time and her partner was like, you just don't want to have sex anymore. And so they hadn't had sex in years after recently getting married. And so she was telling me that she was like, I realized that a lot of it was tied into my focus and that I just felt bad that I couldn't connect. And then that I'd get in my head even more about that. Like, God, he knows that I'm not connecting, that I don't want to have sex. And so it's driving him away. Then he's going to leave. What am I going to do? And then that starts going down. And so they got into this thing where they eased back into it when she felt like she wanted connection, but she wasn't quite ready for sex. It would start with holding hands, and then like it moved from holding hands, and then they would like hold hands in the bedroom, and then they would do, so it was this gradual kind of reintroduction. But even coming up with those cues that you don't have to verbally communicate, but having those kind of things, like you do it once, you tell your partner, this is what I'm doing, and then that introduces like, okay, we're both on the same page. Let's go forward from here.
Yeah, I can imagine that would be very fatiguing from a partner, because I hear a lot of the complaints from patients that, like, my partner's not interested. There's always some excuse. And that can create a lot of like strain and anxiety. And then you can end up in a sexless marriage.
Yes.
So I think you're right. Communication is super important. But also, the partner needs to be open and receptive to working with them through that. And I always say, like, what you're describing is almost like being open to responsive desire, like being where you're like, okay, I don't want to have sex right this second, but like, I know that if we are close, maybe we hold hands, maybe we touch each other, maybe we snuggle, that I may get in the mood.
Right.
In terms of like taking medication before sex. So these medications are what we call vasoconstrictors. So they decrease blood flow to certain parts of the body, including the genitals.
Yes.
So that may affect potentially arousal for women because they'll have less clitoral tumescence, and erections for men because they're not going to get as much blood flow.
Right.
Do you see a lot of that in your patients?
Yes and no. So it's a double-edged sword, because while some of that could happen, sometimes people say that they really feel a tremendous benefit because now they can connect to their partner and they're not distracted by 100 million different things. So it really depends on what that trade-off is.
Yeah.
So it kind of depends on the person.
Right. And I think we can always help with increasing blood flow, even through a vasoconstricted vessel, through medications or things like that, if needed in those circumstances. In terms of like orgasmic difficulty, I think a lot of it probably stems from this inability to focus and connect, particularly for women, I would say. In terms of like becoming more present, so dealing with the thoughts about focus and body image issues and rejection sensitivity that they're experiencing, say they get all that under control, it still requires a degree of focus to reach climax.
Yes.
And so are you seeing a lot of difficulty in orgasm with women? Do they report that to you?
I have heard that quite frequently, that it is difficult for them to get into a spot where they are capable of doing that. The thing that confounds this is, again, a lot of times I'm hearing that within the context of a safe, stable, healthy relationship. And that's what kind of leads to, if something was new and exciting, I wouldn't have this issue. And that's what kind of leads to this kind of balance of like, is it a problem with the relationship? Is it a problem with me? And so it's kind of reframing to them like, this can happen. This can happen. And you need focus in order to get where you're going on this. So I feel like a lot of this is not only communication between the partners, but if this is something that, honestly, as a practitioner, if I'm lucky enough to be the recipient, that I feel like they trust me enough to have these conversations, this is something that, again, from a non-judgmental place, you get this opportunity to talk to your patients like, it could be what's happening. This isn't a reason to jump ship. Let's kind of explore this more. And so I think that, yes, you do hear about it.
That's so interesting because you bring up this point of like, yeah, now they'll have more stimulation if they have a new relationship. And so they may be able to, that's kind of a positive for them, for their brain. And so they're able to focus more and enjoy sex more. And so you might start thinking like, oh, every time I'm in a long-term relationship, I leave and I have better sex. Or maybe you do have some infidelity and you have great sex with that person. Yes. And and you're like, oh, now I need to leave my partner. When in reality, it's just this sort of combination of sexual dysfunction, inattention, and lack of stimulation or boredom that are all causing this problem. Mm-hmm. That's fascinating. Yeah.
And, the fix for that, for patients that are in long-term relationships, I mean, if you understand that this is stemming from a lack of stimulation and mental stimulation and boredom, per se, it could be as simple as changing your location. It could be go to a different room, go to a different town, go do something else different. Go introduce something that's like more playful. Do something different. And because I think so many people, they just repeat the same thing over and over and over again and expect a different outcome. It's wildly frustrating. I think that this is just something that I'm so glad that you are one of the safe places on the internet where you can talk about this freely.
Yeah, absolutely. I mean, I think novelty is so important even for people who are not neurotypical, because if you think about it, right? Yes, you like vanilla ice cream. You like having it. It's good. It's delicious. But if you have it every day, you're sort of bored, right? You want a little variation. And if there's comfort in having some stability and knowing like, this is how I orgasm. This is how it's going to happen. It's going to be great. I know what to expect.
Yes.
But if you think about, you change one little thing, and interestingly, even if you do something new with your partner, that's enough. It doesn't have to always be in the bedroom. It can be even outside of the bedroom, where if you try something new, you go and you take a class together, a new type of class, anything, that you will now have a little bit more chemistry in the bedroom that day because you tried something new. And so it doesn't have to be like, oh, I'm going to go buy whips and chains. Like it can be very, very minimal. It can be like holding one hand a different way. It can be going into a different room. It can be wearing a shirt, not wearing a shirt, like something just very minimally different, but different enough that it offers some slight challenge or some slight variation.
I've told people just flip sides of the bed, even flip sides of the bed, like go upside down on the bed. So where your feet normally go, start there, like just something enough that it feels a little bit different.
Yeah, and I will plug, like, there are some very easy little, like, wedge pillows that you can use that can change positions, that don't have to be, like, a full-on swing that you have to hang somewhere. Like, just little things, and they look like they're just back support pillows, so no one has to know, and, all those sorts of things. But, that's sort of a simple, easy thing to do.
And then you can use it for back support.
Absolutely. Dual purpose. After you clean it, make sure your kids aren't all over it. The other thing that I've seen on your content is that ADHD people tend to mirror people when they meet. So sometimes they will literally like pick up and do things maybe in a similar way, or talk in a similar way. And that's a great way to actually build rapport. So if you look at people who talk about negotiation, or people who talk about building relationships, it's often very positive for the other person to be mirrored, because they automatically like you, right? They automatically enjoy your personality and enjoy you because they see themselves in you, although they don't realize it. And so that, I can imagine, when you meet someone, can be really like, you can immediately love this person or think they're amazing. And then over time, they're going to transform into their normal self potentially. And so how does that affect people's relationships, whether they're romantic or not?
So I can tell you, a majority of my 20s, I was just a chameleon. Like, I could, depending on who I was around, I was a totally different person. And the thing that gets difficult about that is that you just start to lose touch with who you actually are and what you prioritize and want in a relationship. I see it in males and females, but I think societally, I think it's almost imposed on women a little bit more to just like blend into the situation a little bit better. In relationships, like if you are having that, you know, and I think a lot of this stems from that rejection sensitivity, you find parts of yourself intolerable, so you mask them to look like something else. I think that you get into a real issue with this self-perpetuating cycle where you've changed parts of yourself. You finally get into this relationship. It's a long-lasting relationship, and then you start to show parts of your authentic self, and then you're getting this like, ugh. And so then it's like, okay, well then why did I show this? You don't even like me for who I am. And then it starts to degrade the relationship from within. And so it's really difficult. And I think, again, I wish there's no pill for this, right? There's no, like, a part of that just comes from an intrinsic understanding of who you are, what you like, what you expect out of a relationship. And again, because that frontal lobe develops slower, you might not even know that for a while. Like for women, it's like 26, 27, 28, where that actually starts completing that process. So you blasted through your 20s by then.
That's crazy. I mean, I can't even imagine like some of these, like it's a disorder that you technically have your whole life, right? Your brain is just different, right? But it's diagnosed at it. So you're dealing with it throughout your entire life where you're building friendships, you're building relationships, and you are probably struggling like quite a bit in terms of maintaining close connections with people who as friends and then as relationships.
Yeah.
I saw something where you said that kids with ADHD by the age of 12 have had significantly more rejections and negative comments from parents, teachers, and siblings than the average person.
I know. And it's so sad. And I think, I mean, that's just an estimation. But then when I went back and actually thought about like my own life, even things like I was getting like looks and imperceptible kind of like nonverbal cues. Like people were telling me to sit down or to calm down. I mean, just consistently. And then my sister, whose brain works like an actual computer, I don't even get it. Like none of that, and was heralded as like just this, you're doing everything right, everything's great. And so like you're seeing that juxtaposition of you and your sibling, and that becomes really difficult too. But she's great.
Well, you obviously had amazing parents. I've heard your story of how they supported you through getting the diagnosis and then ultimately finding out you had the diagnosis.
Yeah.
And that's like so brilliant and wonderful. And I think it must be even harder for people who don't have supportive parents or who think like, you know, or don't even get them treated because they think that their kid is just lazy or not focused, not capable. And so that's where I really worry. So as a parent, what can you tell parents? Obviously, people listening here care about like being healthy and being better. So what are some signs that maybe they should get their child evaluated? And are there things that they can do while they're waiting, as there is difficulty for some people getting someone who's an expert in ADHD to like see them?
Yeah.
What can they do to help support their child, maybe prevent them from struggling so much in the short term before they can get fully evaluated?
I think that if you're just like what we talked about with the criteria in the beginning, if your kid is struggling with inattentiveness in school, like difficulty staying organized in school, and again, a lot of that is developmental, right? You're not going to expect a 7-year-old to function like an adult. That's just insane. The teachers are the ones who see it all. They see it all. And they're not going to be able to be like, your kid has ADHD, because that's a medical diagnosis. They're not going to be able to tell you. But they'll be able to kind of tell you, like, these are the areas we are worrying about. And so oftentimes, you know, I have a lot of patients with children with ADHD where both parents aren't on the same page. One of them wants to medicate, one of them doesn't, or one of them believes that there is something physiologically wrong. The other one is like, no, this isn't a thing. I was exactly like this when I was little. Some of that time, I'm like, you know, this is the thing that's similar in both of this is you want the best for your kid. And so you don't have to don't call it anything. You don't have to call it ADHD. just address what's happening right now. No matter whether it's ADHD or not ADHD, your kid isn't doing great at school. So what can you do in the classroom at home to make it easier? So like in the classroom, are there modifications that you can do? Like maybe they need more one-on-one time with the teacher. Maybe they need to sit closer in the classroom so they get less distracted than in the back. Maybe they need to get their vision checked. Maybe they need to get their hearing checked, things like that. What can you do? Because I think sometimes even parents are getting caught up on just like the label of it and the stigma of it. Mm-hmm. And that comes with education, that comes with time, that comes with, if they're willing to hear it. Because sometimes you're not going to get to that spot. But the goal is to take care of your kid. And so how are you going to do that?
And if you guys like this clip of the Rena Malik MD podcast, make sure to check out the full episode with Dr. Sasha Hamdani right here.